Welcome everyone. Tozina, can you hear me? Swati, Hamid, Lilian, thank you very much for joining us. Happy to see you because we were worried we couldn't see you. So this afternoon we have other four very interesting presentations, and I would keep the same format as this morning, that we do all presentations first, and we can write down any questions we have for our presenters, and then we have a common discussion at the end. I would invite all participants to stay maximum within 12-13 minutes. I have this post-it. When I show this to you, it means that you only have 2 minutes left. That's okay? Good. So we start with Fiorenzo first, with Fiorenzo Polito.
Yeah, I'll share my screen. While I'm sharing my screen, I'm not sure that I'll be able to see your post-it.
Okay, then I will say
that should be all right. I mean, I monitor myself. I should stay within 11 to 12. Okay.
Thank you, Fiorenzo.
Can you see my slides?
Yes, we can.
Okay, perfect. Hello, everyone. For those of you who don't know me yet, my name is Fiorenzo Polito, and I'm a PhD candidate at the Faculty of Political and Social Sciences at the Scuola Normale Superiore in Florence, Italy. And today I'll be sharing with you some early reflections on some evidence on how Italian development NGOs have been impacted by the COVID-19 pandemic. My presentation is divided in two parts. In the first one, I will provide a brief description of Italian development NGOs, what they are, their origins and characteristics. So to better understand the second part of the presentation, which will be on the matter of evidences of COVID-19 impacts on Italian development NGOs. So very briefly, Italian NGOs date back to the 60s, a period in which they consisted mostly of spontaneous volunteering groups, independent and self-funded and quite informal, coming from the two main cultural areas in Italy at the time, the Catholic area and the leftist area. Over time, those groups were able to secure for themselves bigger political, institutional, and social recognition, so they started to become more formalized. What happened in the 80s was a sudden increase of Italian ODA, so Overseas Development Assistance, public spending for international development initiatives, which also NGOs started benefiting from. And this has caused the incredible qualitative and quantitative expansion of NGOs, along with processes of professionalization and bureaucratization. In the 90s and early decades of the 2000s, NGOs in Italy have gone through a series of political, economic, and humanitarian crises, like, for example, a serious reduction of public spending starting from the 90s, which has led to quite a change in the development sector in terms of non-governmental organizations, and also the arrival of international development NGOs, which opened their national branches in Italy, put the local NGOs under some stress because since then they have dominated the market of private donations. So what we have in Italy now is a quite heterogeneous scenario in terms of non-governmental organizations, but we can see that as a polarity with, at the one end, a small cluster of influential and economically relevant NGOs, which are made up by the national branches of international NGOs, and some Italian NGOs which over time have become specialized or service providers, like, for example, humanitarian NGOs or other types of NGOs. And this is well summarized by this graphic here showing the top 10 of Italian development NGOs in 2019 based on their budget. And you can see that most of them are either international ones or organizations focusing on humanitarian and relief actions, like Italian ones, like Intersos or Emergency. At the other end, we have a very vast and heterogeneous group of NGOs with different sizes from medium to small. Coming to COVID-19 pandemic and Italian development NGOs, there are a few general remarks that can be made. So COVID-19 has come at a time in which development NGOs in Italy have been already under pressure for some years. Just to quote the financial crisis of 2008, which has put a lot of stress on NGOs in terms of economic sustainability. And then the legitimacy crisis starting in 2016 with the criminalization of NGOs, especially those operating search and rescue missions in the Mediterranean. So that said, COVID-19 can be described as an accelerator of both positive and negative dynamics that were already at work in the sector before the pandemic. Data for this presentation have been, can be divided into groups: quantitative data, coming mainly from 2 sets of questionnaires that were administered through this accountability and transparency project called Open Cooperazione. I can share the details with you later, in cooperation with the Italian development NGO networks. Questionnaires were administered at 2 different times: in April 2020 to explore short-term implications with over 150 respondents, and then later on in February 2021 to explore medium and term consequences with 84 respondents. These data, the process of collection and analysis has some flaws and some limits, because the data was able to access cannot be disaggregated because of this clause of anonymity that ensured participation by NGOs. So we cannot really see trends affecting different groups of NGOs, which is indeed a limit. And also the 2 questionnaires are not perfectly comparable between them because different question sets were used. Nonetheless, I think that the results from these questionnaires are indeed useful to at least identify some trends in the sector. And then quantitative data have been triangulated with some qualitative data coming from a series of expert interviews they have conducted in the framework of research between October and November 2020, and review of some non-academic articles available online, and the participation to sectorial events like online webinars on this topic. So delving into the evidence that we have, I've divided them between short-term and medium-term impacts. Of course, what happened to the NGO sector is similar to what happened to the rest of the world as the COVID-19 pandemic broke out the first time. So 91% of them had to reduce or suspend their ongoing activities. And since then, in the aftermath of the early months of the pandemic, the main concern has been the reorganization of their ongoing activities. As this was, of course, a very demanding process, both in terms of human and economic resources, NGOs, bigger NGOs, were more able to, with bigger organizational capabilities, were able to reorganize their activities more promptly, whereas smaller NGOs, of course, found themselves more at risk. How NGOs have sustained this reorganization of activities, this has happened by either reconverting existing resources, negotiating with donors, for example, or by launching brand new fundraisers. Nonetheless, despite these efforts, already in the first month of the pandemic, revenues halved for 40% of responding NGOs. What I find more interesting to highlight is that despite all these issues, all these stresses, NGOs were also able to mobilize directly to address the effect of COVID-19. And this has, of course, happened abroad, which is the mission and vocation of international NGOs, with a broad set of activities here. But even more importantly, 40% of NGOs have reported that they were able to mobilize in Italy as well. And this was done not only by those NGOs with a global health background, which have directly supported health facilities in Italy, but also smaller NGOs with fewer resources have activated their territorial networks of volunteers in support of vulnerable population with a wide array of activities, which is a peculiar trend, I think, that needs to be stressed. In terms of medium-term impacts, economic sustainability is still at the center of, is still the main worry regarding NGOs. 68% of them are prospecting a reduction of budget, while 81% have reported a drop in individual donations. So despite the new fundraisers that I was mentioning before, NGOs have entered into competition with other Italian actors that have started their own fundraisers at the same time, like hospitals or the civil protection. It is interesting to highlight that NGOs have reported that during the COVID-19 pandemic, those months, they were more able to secure funds from private donors than public ones. And in fact, only 20% of NGOs have accessed public funds. And this is particularly interesting in Italy because the majority of NGOs are heavily dependent on public funds, and private donors have a limited role. In terms of reorganization of work, there are 2 trends that I would like to highlight. In describing some of their coping strategies to address issues caused by COVID-19, NGOs have mentioned new partnerships. 1 out of 3 respondents said they would invest in forging new partnerships and consolidating old ones. Localization and decentralization process for Italian NGOs are nonetheless not a very important topic, and this because most of the Italian NGOs are very limited in sizes and budget, and only 4% of NGOs is considering replacing expatriated staff with local staff, just because most of them don't even have that big local staff outside of Italy. And only 1 NGO out of 10 is working on creating regional offices, again, for the same reasons. Not many of them could afford such a process. And technology, again, which has been at the center of many debates in the conference and also this morning, has been indicated as one of the coping strategies. Digital transformation processes are underway in the NGO sector. 70% of them are digitalizing their working spaces, and working remotely will become structural for 60% of them. Nonetheless, some respondents have highlighted that they have serious doubts about the idea of going digital, mostly because many NGOs in Italy are focusing on micro-realizations, that is a type of intervention based on proximity. And digital transformations, again, are not impacting all NGOs at the same time, because it is a economically demanding process that only bigger NGOs are really able to go through. So digital transformation is generally slow. So to conclude, there are some preliminary implications that can be drawn from what I just said. COVID-19 has acted both as a critical juncture after a series of crises interesting the sector, and as an accelerator of ongoing trends. First of all, it has shown deep disparities among the organizational capacities of larger and smaller NGOs in Italy. Secondly, it has further exacerbated competition over a limited pool of economic resources. And finally, it also provides an opening, a potential opening for development NGOs to reflect on their positionality and their mission. And I'm referring to the fact that many NGOs, which were mostly engaged internationally, also looked again at Italy as a country where to activate their interventions. So I believe this is all. I hope I stayed within the minutes, and I'm looking forward to the discussion. Thank you.
Thank you very much, Fiorenzo, for your very interesting presentation and for staying absolutely on time. We will discuss your presentation later. We can now go to the second presentation today, which will be presented by Tosin Ishola and Olwatuin Olayade. Maybe you are mute, Tosin? Are you mute? We cannot hear you.
You're not muted, but we can't hear you, even with your mic on.
Yeah, we cannot hear you. Maybe someone from the technical support can help us. Yeah, you are not mute. You are not on mute. Maybe Tosin, would you like to try to disconnect and rejoin the panel? I don't know, sometimes these things work. I don't know why, but we go to the other presentation and then you join after Ana-Luisa. Perfect. See you very shortly. Yeah. Ana-Luisa, are you here?
Yes.
Would be okay for you to anticipate your presentation.
That's fine, no problem. Okay, so let me just share my screen.
Thank you very much. Thanks, Ana-Luisa.
That's fine. All right. All right, you can see my screen?
Yes, we can.
Okay, great. So let me know if I go over the time, okay? Okay, great. So hi, everybody. Nice to be with you all. My name is Ana-Luisa Silva. I'm a PhD candidate at the University of Lisbon. And today I'm presenting a paper, or actually rather more like a project of a paper called entitled COVID-19 Challenges and Responses, Experiences of National NGO Platforms. I will start by giving you a little bit of a context and background on this research, which actually draws on from data from my PhD research, which is on innovation and development cooperation from the perspective of development NGOs. Through my research, I'm trying to build a better understanding of learning and innovation cultures in development NGOs across different geographies. And to do that, I established a partnership with Forest International, which is an umbrella of national NGO platforms and regional coalitions in 5 continents. I've used a mixed methods approach to conduct my work, starting with an online survey with collecting quantitative and qualitative data, and then following that up with semi-structured interviews. And just to set the context a little bit, national NGO platforms, they are essentially sector associations. So in every country, they bring together NGOs that are working in development, and they act as Alan Fowler says, who has one of the best definitions in my opinion, as coordinating bodies. They help regulate the sector to increase accountability, but they also work as a network to advance collective actions of their members. So I just wanted to give you an idea of the sample that I'm working with. I basically collected data from about 20 organizations, and my sample is quite heavy on Latin American platforms. And in terms of the time frame for my research, I started working on my PhD in 2018, and after the first the theoretical part of my work, I started working on this partnership with Forest in 2019. And of course, when I was going to send out my online survey, the pandemic hit. So I wasn't actually thinking of obviously, as nobody was, of working on COVID-19, but obviously because of the timing of my research, it ended up that COVID-19 obviously showed up in my work and had to be addressed. So I decided apart from everything else that I'm analyzing for my PhD, to produce this, to try to look at the data and to use this opportunity at DSA to get feedback from you on the potential of this data to produce a better understanding of the impact of COVID-19 and virus containment measures in development NGOs across the globe and how they responded to the pandemic. So, and before I explain and I go through some of the findings, I wanted to have a look at other surveys and reports that have been coming out over the past year. And what do they tell us? So a lot like Fiorenzo's presentation before, some of the reports that have been coming out, a lot of them done by national platforms that, like the ones I've been working on, show that development NGOs on the ground have been experiencing a shortfall in resources at the same time that they see an increasing needs on the ground. A report by Civicus Alliance in July last year showed that more than 80%, actually most like 90% of the organizations were in a financial struggle because their income had reduced, and for 40% of them, they couldn't continue their work, or they had to actually stop activities. And also that study found that only 18% of donors were allowing grantees to actually change the use of the funding for pandemic activities. So at the same time that this funding struggle is going on, other reports are showing that CSOs still have responded very significantly around the world, bridging gaps that the state has left and using their strong presence on the ground to reach out to the most vulnerable. And we've seen that in a lot of the presentations in our panel this morning. And then it's also interesting to point out, a bit like Fiorenzo was doing earlier as well, that some analysts were pointing out that the pandemic could be seen either as a turning point, and because crises sometimes are turning points, but it also could be seen as an opportunity to accelerate some trends. And in terms of the NGO sector, early on, analysts were looking at some of the trends that could be accelerated, that were already happening, but that could be accelerated by the pandemic. And first, of course, is digitalization, which was happening already in other sectors, but there was a potential to be accelerated in the NGO sector. Secondly, was the closing of civic space, which was already a trend across the world due to polarization in a lot of political regimes, and due to the lockdowns and measures imposed by governments. And finally, aid localization, which has been a debate for quite a couple of decades, but there was a potential now to be accelerated because of expats being taken out of the ground, in international NGOs closing their offices and so on. So what does my data tell us? First of all, surprisingly, or maybe not so surprisingly, because my online survey was administered between May and July, which corresponded basically to the first wave of COVID-19 infections in most countries that responded, especially in Latin America. There were very few initiatives linked to the pandemic that were innovative initiatives, because remember that my work is on innovation, that were mentioned in the survey. ABONG, which is the Brazilian NGO platform, was the only one. They were the ones that responded, one of the platforms that responded later, but they were one of the only NGO platform that actually identified a couple of initiatives that were responding specifically to the COVID-19 challenges. And one of them was Rede Solidária, a solidarity network, where they put together this website where they mapped all the activities of their members and even other CSOs across Brazil. But they also provided an opportunity for organizations to fundraise, to ask for help, and for just people to go in and say if they wanted to help. They also did something else which was much more directed at the staff of CSOs themselves, because again, NGO platforms, they, a part of their work is actually to respond to be a sector association and to respond to the needs also, to the professional needs of their members. So they did this initiative where they provided emotional support to the staff working in the front lines. They called it Balaio de Cuidados, which can be translated as care basket. And then if we look into the interviews, which gave us a lot of information on one of the aspects that I'm most interested in for my PhD work, which is the reasons and motivations of these organizations to innovate, we can see that among the main reasons to innovate that were highlighted by different interviewees, COVID-19 can be traced back to two of those main reasons. And the first one is that COVID-19, as in fact happened with previous crises, is given as an example, even before it is brought up by the interviewer, as a reason for organizations to both adapt and innovate. And both adaptation and innovation come up in this work as strategies for platforms and their members to cope with what is going on. And sometimes the boundaries are not very clear between these two aspects. Sometimes they are happening at the same time. So it really depends on context. For example, I think we'll go on and talk to you more about examples later. But connected to another reason and rationale to innovate was the enabling role of ICTs and digitalizations, especially in advocacy and communications. That was already a trend during the pandemic, before the pandemic, and the COVID-19 has just accelerated that. And again, speaking about this digitalization, like Firenze was also pointing out, also my results showed that this had both positive and negative aspects to it. On the one hand, it is an alternative for physical meetings, and it allows for wider participation in international networking. Again, we're talking about national platforms, so their members within the countries are spread out, but they also belong to international networks. So they were already doing these international connections, but at the national level, it was less common, and it was something that maybe perhaps wasn't new for everybody, but it was increased. But at the same time, there's still obviously an exclusion aspect to digitalization, because not everybody has access to the internet, and some members, especially in remote areas, are still excluded. But also there were concerns that concerns still already in between July and September, when I was doing the interviews, there was already a lot of concerns about excess of information, online fatigue, and the fact that that online exchanges can be more superficial, can lead to more superficial relations and reflections. In terms of closing of civic space, and again, this also might be a trend that was highlighted because my sample was quite heavily from Latin America, which we know that in the past few years has been experiencing quite a few issues in that regard. But it's still, we see that also from Civil Alliance's Civil Society Monitor, that civic space is deteriorating around the world. And what my interview shows is that COVID-19 restrictions were being used to repress citizens' individual or collective freedoms, and that many of the organizations had to stop ongoing advocacy work on other topics and focus on the immediate needs of the pandemic and on the rights being suppressed. So that it had to find ways to guarantee rights and find other ways to protest and to defend people's rights, apart from the usual work that they could do before the pandemic. And then I would like to,
please.
A couple of minutes. Okay, I'll finish it up. I'll just give just one case that I would like to highlight, which is that the platform from the Philippines was actually one of those that showed to be more faster in responding to the crisis. And that might be because the Philippines is actually a country that is very much prone to natural disasters. So they already had quite a big disaster risk reduction management capacity. And they were able to use existing networks and hubs to put together a very quick response. So very early on in April, they put together a statement. They activated 11 regional hubs started weekly talks with their members. They put together a live database that was showing not only what people needed, but was showing messages of hope and positive stories from members across the Philippines. And also they were lucky enough to have an endowment which allowed them to have flexible funding flexibility to respond to the needs of their members. So I'd just like to conclude, because I know that I'm going a little bit over time, just to say that this research, again, it wasn't focused specifically on COVID-19, but it did provide an opportunity to understand the early challenges. And again, to see that this that the crisis was an opportunity to innovate, but it also accelerated some trends that we were already seeing. It also shows that there is a lot that organizations, especially networks, can learn from organizations in the global South that are more used to facing crisis, like the ones the pandemic one that we are facing, and that like ones that we might be facing more frequently in the future. So thank you.
Thank you very much, Ana Luisa, and I'm sure there will be other opportunities during the discussion to go more into details in some examples and other interesting aspects that you mentioned. Thank you. Let's try to go back to Tozin.
Okay, can you hear me now?
Yeah, we can hear you perfectly now. That's great.
So thank you. Good afternoon, everyone. Let me just begin the process of sharing my screen. Where is that? My desktop. Okay, let's do this. Okay, let me just find. Just set up a slideshow. Okay, can everyone see my screen?
Yes, we can.
Okay, so yeah, good afternoon again. My name is Tosin Ishola, and I am presenting this paper with Olajide Toyin, but I will be doing the presentation. And our topic is vulnerability and survival in the face of the COVID-19 pandemic. And just to give a bit of context to what we will be talking about today, I'll introduce the nonprofit organization that I founded, and I work as the program director Together for Needs Initiative, and just do a quick introduction to the slum communities and talk about the vulnerabilities in respect to the right-based approach and assessing their well-being, talking about education, access to healthcare, water, food and shelter, all of that. But also talk a bit about our intervention strategy, and then we will conclude. I'm opening up.
Sorry, Tosin, just a second.
Yeah.
I can see your screen, but have you started your presentation yet?
I'm about to start that now.
Okay, that's perfect. I was just wondering whether there was a technical problem.
No. Yeah.
Perfect.
Okay, so just to give a brief introduction to the organization, Together for Needs Initiative, we founded in 2017, began operations in 2018. We had our first outreach in October 2018, and we're really targeted at the poorest and most vulnerable groups in society. In Nigeria, where we work, there is still a very weak social protection regime. So there is a lot of work required on our part to be able to provide some sort of social assistance and social welfare to vulnerable groups. So we work mainly with widows, orphans, persons with disabilities, the elderly, and just indigent families. And one of our ways of fundraising for our work is to do like a donation drive. So we collect donations of new and next to new items, and we sell it in a very low income community at little to nothing. Some of those funds we deploy in reaching the target groups that we work with, and we also leverage individual and corporate sponsorships for our work. We are a bridge really between philanthropists and beneficiaries, and we just try to do some sort of redistribution of wealth in our own little way. We've reached over 7,000 persons across the 7 small communities we work, but today our conversations are really about our work in the slum communities. And these are just images from some of our outreaches where we provide maternal support and just sanitary products, sexual and reproductive health, training. Our charity sale that I was talking about, just selling some of these items. You can see people just shopping around, medical aid, that's what's going on at the bottom left, and of course, just some of other interventions that we held during the COVID-19 pandemic. This was in the heat of the COVID. This was just a program, an outreach that we organized for children, living in the slum communities. And then these are just some more images. Let me go on to the slum communities where we work. So we work in Nigeria, in the southwestern part of Nigeria, in Lagos State, across some mega slum communities in Owerri, Shoki. You wouldn't be familiar with it. It's called, one of it is called Ferry, another one is called Okeri, Aralamo, Odonfa, Oluwaseun. They are just names of slum communities, where we work, and is in the urban area of Lagos, very densely populated and mostly ignored in structural development commitment by government. And then we're talking about their rights and well-being, and then right to housing, right to food, to water, to a healthy environment and education. And housing is supposed to be almost like shelter is supposed to be like a basic necessity. Many people consider that it's proof that you have rights, your human rights are valued and respected. And ideally, a proper shelter would have roof, floor, walls, overcrowd, electricity and all of that. But it's really not the case in many houses in slum communities, almost inhabitable when we visit, and we just wonder how people are able to live there, but that's their reality. So we'll just be talking also about the condition of housing in those slum communities, and these are images of just what it looks like, in some of these, rooms, 8 to 10 people.
Sorry, Tosin, we cannot see your presentation.
Okay, so these were images I was referring to, talking about some of our outreaches and the works that we did during COVID. And so these are just some more images. So I was just somewhere here talking about, shelter, and I'll just move to this slide. So this was the image I was referring to at the points that you prompted that you couldn't see. And this is just what a shelter looks like in the slum communities. And an average of about 8 to 10 people live in some of these rooms. So you can imagine just how impossible it is to socially distance, because they're like, what are you saying? We're about 30, 15, 20 in our rooms. How are we going to distance ourselves? You know, and this is what a washroom looks like. You know, this is a toilet, you know, and this is really just poor. Like I said, an average of 8 to 10 people live there in waterlogged rooms, you know, and then they still pay for these houses. So it's not even free. So they still pay about $7 to $15 per month, you know, to reside in these poor looking houses, you know. And then right to food, we were trying to establish what food security was like during COVID. And it was really bad because many people that live in some communities are often people that their breadwinners do menial jobs, you know, and in the heat of the COVID, their employers are like, you don't show up for work, you know, because I'm afraid that you may bring COVID into my home, you know. And then it meant that many of them were cut out of earning income, and then they were stranded. And then, of course, it became harder to survive and get food. So our interventions, providing food aid and COVID relief was really something that went a long way, you know. They really couldn't, the only source of protein is like egg and beans, which is very rare and occasional. They don't take turkey, chicken, all of that is just something they hear about. They can't practically survive on those kinds of meals. So hunger and malnutrition is something that is really, really profound in those areas. And during the pandemic, they had said that, you know, many of the respondents said that it was actually better to buy food than to cook food, because the resources required to make the food were just not there. So they would rather buy food that their children can eat. And sometimes they eat once a day, but they can't tell you that they even eat once a day. They eat based on availability. And that just shows that that right is almost missing. And then rights to water. They pay for both drinking water and water that they use for cleaning. And then I'll show you in some other pictures. They get water from like a distributor. Let me see if I can, yes, something like this. So they have tanks like this across many places. These tanks are erected by people who have paid to be a distributor for water. So the pipes are drawn from kilometers away, and they have paid to lay ownership to this tank. So the water has to be sold, but even the water is not clean. Sometimes it's high in alum, it's high in iron, sometimes it's salty, so the water is not drinkable. So they have to rely on pure water, you know, which costs about maybe almost, for them to take water every day, buy pure water, they have to spend about $1, you know, per day just buying water to drink for one person. So you can do the math. If 8 people live in a house and they all need to drink water. But I mean, one of the respondents, Abeni Raji, confessed to saying that she drinks the water from the tank, even though it is unclean and unsafe for drinking. But when there is no resources to buy water, she's gonna have to drink the water just the way it is. Right to health. Healthcare insurance is a myth. Even in Nigeria, generally, even beyond the slums, there is still a high ratio of people that pay out of pocket for healthcare expenses. You know, so you can imagine that in the slum community, health insurance is not to be seen. I mean, just yet. So many of them say that they just believe that their faith, they would be fine when they are ill, or they just rely on community nurses that just administer drugs randomly or drips or stuff like that. And they still pay heavily for this thing. So if it was structured and if it was, you know, if social protection was right in the way that it should be, this money could have been deployed. Instead of paying a community nurse, would have been deployed to health insurance, for example. So healthcare is really poor in the slum communities, and they only visit the hospital as a last resort, and in cases of emergencies, they self-medicate most of the time. You know, and right to a healthy environment, of course, it's a slum, so it's obvious that there's nothing fancy about it, but it's even worse around here because the refuse is what they use to fill in the water areas, just so that the houses do not sink. So it's definitely unhygienic to live, but they believe that that's the only choice that they have. And so they have to live where they can live because this is where they can afford. Housing in Lagos is expensive. And then the slum is already densely populated, but there's really nowhere for other people to go. So they just believe that they're going to stay in the slum and just continue to believe that they will not get sick or that their health will just be protected by their faith. So we have observed like deplorable situations, and they live just really in dung hills. That's the reality in those slums. Right to education. There is really just one community school, which is a free school in the entire slum community that we work in Shuki. And because it's a free school, you can imagine that it's overcrowded. Some classes, have over 300 students learning in one class at a time. For those that would not be able to attend the free school, they would have to attend a private school, which they may not be able to afford. So you have a lot of children dropping out of school. And survival during COVID, and I've written yes, we're on track. Survival during COVID, the slum residents confessed not to have received any relief from government. And at this time, our organization deployed food relief to about 1,500 people. We gave clothing. We also delivered school supplies to 100 children to ease their entry back to school. We provided 2 months supply of sanitary pads because period poverty is poverty too. We provided shelter for one family. And as a strategy, we've also adopted a school in the slum community just so that we can improve every aspect of the school. And I have now also collaborated with another nonprofit founder, and we have just recently launched a social enterprise that is solving the issue of healthcare. So what we've done is we're a tech platform, basically. We aggregate health insurance products, but we also design microinsurance products, for people like this. And the behavioral changes we noticed, slum dwellers did not believe that there was COVID-19. They thought it was something that the government was making up, and they just couldn't understand why no one was dying in the communities and how they were still able to go about their lives and not, contacting COVID. And they only wore face masks when we insisted that for you to be part of this intervention, you have to mask up. They didn't really believe that it made any difference. And they became more desperate for survival. We held outreaches before the COVID pandemic, and they'll be orderly, but during the pandemic, they were agitated, they were anxious, they were really desperate to survive. And life was not really the same because many of them were just agitated, not knowing when this will end or when government would ever do anything for them. And in conclusion, even though the pandemic is now over, seemingly in Nigeria, there is still no single social register that identifies poor and vulnerable groups. And it's very hard for you to do interventions when you cannot even reach those that you're trying to reach. So the COVID pandemic was a fantastic opportunity for these data to have been collected, but it still really wasn't. Slum dwellers also remain highly uncovered and marginalized. They didn't receive government's COVID-19 palliative, like I said, and it was just strange to us nonprofit founders to say, people working in nonprofit space to say, if the palliatives didn't get into the slum community where the poorest of the poor live, so where was it distributed? And the draft national social protection policy remains unimplemented, and then every other thing, just like I said, social distancing, wearing of masks is very impossible to enforce in slum communities. It's better to preach education and to also ensure survival in case of future pandemics or outbreaks like this. Thank you so much. These are just the references. Thank you so much.
Thank you very much, Tozin. Very interesting presentation with lots of grounded material that I'm sure we will discuss further during the discussion.
Thank you.
And now we have our final presentation by Ibrahim.
Thank you so much, Emmanuel. I will try in 10 minutes trying to share my actually. I assume you have seen it now.
Yeah, we can see it. You are opening the PowerPoint. Yes.
Okay, that's fantastic. I will try in 10 minutes or less trying, but I would like to engage in conversation, answering your questions. However, before getting to the details of a presentation, it's very important to remember that I will tackle discussing 3 different areas or countries, but it's imagine we have here this morning from different case studies and also just, heard from Italian NGOs and also another Western platform. So imagine in stable countries like here in the West, that it's even influenced or impacted badly by the pandemic at all levels, not only fundraising operations, also kind of human resources, it's at all levels impacted. Imagine that, what's about a civil society organization based in a conflict zone. And a conflict zone, it's an everyday struggle. For example, imagine that we are talking about Palestine, have been for decades under occupation, a bombing, displacement, all of these aspects. Imagine a local, small, medium, large NGOs actually functioning, trying to accommodate and trying, to render service at the same time during the pandemic. So imagine that. In addition, like, Libya, living in the last 10 years, civil war, divided country, no central government, different actors, and more or less Lebanon in the last 3 years, in other words, fragile or a failed states. So no economy, a lot of civil society organization, but also they lack a lot of resources. Their own investment and their own power, all of these, organization in 3 countries, the human resources, volunteers, the staff members who are resilient, defiant, as well are capable and powerful to shift and trying to render service under all these circumstances. So, in very brief, adding to all of these, barriers, changes, shifts, the pandemic, which is actually, even we are living here in the West, actually sometimes, be driven mad from all of the restrictions in a democratic countries and all very nice, but imagine once again countries living under poverty, restrictions, no democracy, and in addition to that, social context, which is very important at all levels. So I will try, to discuss very quick, I have here the conceptual framework, but also I love to use terminology participatory democracy in a conflict zones, or a country actually enjoying sustainable democracy, or as not all as a process, but also as a style of life. Always I use the participatory democracy, which is based or stemmed or actually relied on the power of the civil society, the power of the actors. In addition to that, not only the network, the social network of those or these, civil society organization at all levels. Sometimes you can imagine a grassroots organization actually gonna be more powerful more than governmental organization or public organization in engagement, delivery, as well as responding to the people. And more or less, imagine, like, also we have friends, they actually struggling from the power, or the internet is very slow in Africa, in some stable countries. What about, volunteers who actually function and work in conflict zone? They have no access, but many of them, they use digital technology to increase, to engage, as well as to raise funding, despite the fact, and this morning, our colleague, from Nigeria mentioned the technology and also the resilience of the community mentioned this morning by our colleague Swati about India. All of these things, are applied to the organizations, civil society actors in or from the countries living every day, actually very terrible, very conflicting society, violent occupation like Palestine, and as I mentioned, Lebanon and Libya. So always, trying what actually participatory democracy at the grassroots level. I mean, grassroots level, engaging with the people, helping the people, also using technology, using different aspects, mechanisms, tools, in trying to help the people and to exist and to resist as well as to be more resilient. It's very important. Despite the barriers to the effective civil society organization, their partnership with international organization, a lot of restrictions with the accessing resources, finance, even, I don't want to get another conversation here about the relationship or an equal relationship between the international organization and the local organization, who actually more relying on the international organization in terms of funding. But more importantly, social context, social network, and the volunteering of those organizations, very powerful. And they actually, I'm telling you, they are resilient in the current situation under the poverty, conflict, and all aspects I just mentioned. So COVID-19, even more that, you know, I'm quoting here one of the expert or specialists from Lebanon, who mentioned, you know, straight, I want to quote very quick, the MENA's region capacity to withstand the impact of COVID-19 on its most vulnerable communities and face up to other challenges is conditioned by how significant is its support to civil society will be. Millions of Arabs, orphans, refugees, elderly people with disabilities, widows, and unemployed are depending on it, even though measured. Libya, Iraq, and other areas, for example, they are wealthy countries in terms of oil, but fragile states. More to emphasize in challenges, political violence, domestic violence, economy. By the way, even domestic violence increase in Western countries, and civil society organization in those countries who actually, I know, you know, it's many organizations, they actually about to close or close in Western democracy. What about, you know, countries I highlighted? Economy and lack of opportunities, foreign aid limitation, decline, termination. Even many of international organizations, they have no resources to continue their cooperation with civil society organization in the area. Conflict zone, I spoke about this, and this is the case study of Libya. I don't want to repeat again. The numbers here in the screen talks more about itself in terms even the international organization or the local, but it's very important here in terms of the humanitarian employers who are working with the civil society organization. They have no access. However, grassroots response to COVID-19 covers three main aspects, very quick: connecting local politics with national leadership, like a fragmented country like Libya, transitional partnership, raising awareness in public health issues and leading humanitarian responses efforts in Libya. 9 years civil war, it's even now more 10 years. No access for services. Many countries, many provinces, areas, no access. So here, the local organization take the job at their own capacity. Local cooperation and activism. I talk and I spoke about this. So it's, however, the abilities to foster local partnership, different scales of governance to derive innovative, to provide humanitarian relief in the face of war, natural disaster, and other crises. Community activism is very important in trying, you know, to exist and to respond to the current situation. In other words, the solidarity is very high in these, you know, countries. Mobilizing resources. I spoke about how they use the Zoom technology and others. For example, mainly in Palestine and Lebanon. They use it more in Libya because, you know, Libya, some areas, they have no electricity, even though the same story in Palestine, they have no electricity. And even in Lebanon, the same, but they have capacity. They manage themselves within 8 hours or less or more. Lebanon, I spoke about it, you know, Lebanon, it's very complicated. No government is working, fragile, and now the civil society actually more acting. And even during the pandemic, they stopped protesting in the streets, not walking, but actually they use different mechanisms and tools like technology. And one of the issues even use the cars in order to avoid the restrictions and trying, you know, to send the message, going around by car to trying, you know, to send a message for the decision makers or to the politicians. We are here as a civil society, not only organization, all activists. So the pandemic, however, still actually hitting Lebanon, but, you know, In the last week, they actually more resilience and working and trying to send their message, even though they are living under sectarian and areas, what they called it sectarian democracy, but the democracy is absent, not there at all. Each group, each political group, they have their own charity, they have their own organization, and they engage with their own constituencies, their own members at the local level. A new civic space. What is the new civic space? Sorry, this new civic spaces, as I just mentioned, the technology for the Lebanese, actually using different mechanism of engagement, actually trying to avoid the restriction imposed not only by the government but by certain political group or militias. Even by here, I want to mention very important, a narrow space, however, is given for civil society to operate freely and effectively as only, even before the pandemic, 4% of the world's population live in countries where fundamental civil rights or civil society freedoms, association, peaceful assembly, and expressions are respected, according to Civica's report 2019. So, trying, to move from one crisis to another. This is, applied. I mentioned earlier, Lebanon, Palestine, Libya. I don't want to repeat once again, but here we have examples how they work together in terms of distributing food, raising awareness. They are still resilient and working there, even though look here, the rate of inflation is 72 now or more in Lebanon, even more. Now it's like last year figure. Occupation and violence, it's a different story. This is the cause of Palestine. And you heard last month or 2 months, actually 7 weeks, what happened in Gaza, Sheikh Jarrah, and Jerusalem, all the time trying, to manage their own crisis. Every day, the everyday work of the civil society organization is trying to be part of the national struggle at the grassroots level, delivering different activities, even engaging in peaceful struggle as reporting human rights violations, social media, platform, international reporting, writing, different aspects and different stories. Human security. We don't need to repeat ourselves once again about the human security. Occupation.
1 minute, Ibrahim.
Okay. No development, no human rights, no social security with or within or with living with occupation and civil war or a fragile state like Lebanon. So it's not incompatible or doesn't work at all. Conclusion. Impact of political shifts in the civil society activities. Civil society activities, it's also they involve in political change at different levels, even in terms of human rights, women empowerment, trying to influence the legislations, trying to influence the public mood in terms of changing the current policies, even under the occupation in Palestine, or reporting human rights violation from both, from the authority, local authority, or from the occupation. So imagine like, local organization in Palestine actually trying, to work under two systems, Israeli occupation and Palestinian authority. So it's very hard to imagine that. And once again, assessment of civil society power, origin, limitation, and use. Imagine, it's civil society using, its power, how they were trying to be powerful, and their origin living under kind of different style of lives or jurisdictions or kind of conflict, limitations in terms of finance, even politics, constraints and restrictions, and how to use it, how to handle it, how to live with it, how trying to navigate it, or in other words, not to compromise it, how to negotiate the everyday, let's say, work or constraints, restrictions, as well as barriers. Thank you all.
Thank you very much, Ibrahim. And it was fantastic to have a presentation also addressing specific issues of a region of the world, which is which was uncovered this morning, and which is, of course, in our mind and heart, especially in this last period with everything that has been happening. Great. So we had these 4 fantastic presentations, and there are several overlapping issues and dimensions that have been touched by all the presentation. I have several questions, but I would like first to give the opportunity to our audience and presenters to ask some questions regarding specific presentations, or it can be a general question for all the presenters. You can either talk directly or write your question in the chat. Thank you, Lilian. Thank you, Lilian.
Thank you, and thank you all for this another insightful presentation. I think I'll just start with 2 questions, one for Fiorenzo and the second question for Tosin. Fiorenzo, you mentioned very key aspects happening right now within non-governmental organizations, and the key one I wanted to ask was about competition over limited resources and this disparity we see between big and small non-governmental organizations. So the question is, apart from competition over limited resources, have you looked at competition over the space between the small and the big non-profit organizations, and how the space is changing because of this lack of fund, and how it would impact on some of their agendas since there is a change in emerging issues? And just out of curiosity, are these NGOs working within issues happening within Italy, or are they working as development non-governmental organizations with Southern-based, the Global South, the NGOs there? And if so, then how is the issue of this growing nationalism, populism, shrinking of economy, deglobalization, if we mention, how is it affecting this relationship? So that's your question, Fiorenzo. And for Tosin, very inspirational thing that your organization is doing in informal settlements. Some of the key issues that you mentioned and some of the root causes are things that non-profit organizations cannot deal alone with, and the burden on organizations as yours. And I was thinking, since it's beyond the capacity of what NGOs are, even with your funding, are you working with or planning to work with private sector or maybe the local government for it to be more sustainable and for there to be a shift for these communities living in the informal settlement to kind of have some kind of decent life? Thank you.
Maybe Fiorenzo, you could please start answering Lilian's question, and then Tosin can continue.
Okay, so the first question Lilian asked was about how the space is changing. Between, can I ask you, Lilian, what do you mean by space, actually?
Yes, so you have you mentioned the big NGOs and the small NGOs and the disparities between the two groups. And we can see that, again, there are changes happening because of COVID-19, and some of the main issues that NGOs were dealing with before, say maybe one of the 17 Sustainable Development Goals, would be shifting to maybe healthcare, things to do with sorting out the issues emerging now out of COVID-19. If that is a trend that is changing within those NGOs there, and if they're working with Global South NGOs, for instance, how is this big thing that we have, this deglobalization, nationalism impacting?
Okay, I'll try to address this. It's a big question, I think, and it's very hard to generalize because it's very context sensitive and changes, I guess, from organization to organization. But what I can tell is that, no, so okay, the NGOs I'm referring to are all involved in international cooperation. So their main focus is in the south. One interesting trend is that between big and small NGOs, so big NGOs that arrived in Italy, the foreign ones, were perceived as foreigners really at the beginning, because they had this sort of extractive settler strategy somehow. They were opening up fundraising offices in Italy, but they were not involved in any projectual work with other NGOs. So they were just there to, pump out of money of the private donation market, which was really not touched upon local NGOs. So in terms of shifting of space, I can see that over time, those NGOs, the international ones, started cooperating more with the Italian NGOs as well. So it seems that the playing field has leveled to that aspect. I don't know if agendas are going to shift, because it's too early maybe to say that. The donor market is shifting, of course, because they were mentioning, I participated to this online webinar, and some NGO practitioners were worried about the fact that the donations could be channeled mainly through global health initiatives, lagging behind other initiatives that also need support. So this was something that was brought up on that occasion. The second question about deglobalization, it's a very big one, I guess. So for the international NGOs, we know what their strategies are in terms of localization and decentralization, which is a bit opaque, because in the end, we've talked about that, I think, in other panels as well. I don't know that this strategy of relocate or localization and decentralization is a panacea per se. No, it's not something that you just do and you solve all the problems about that. To that extent, I think that Italian NGOs have a positive quality that they could rely upon, which is finding again what the roots were, because they were used to be community-based organizations, grassroots organization, building bridges and partnerships with local organizations in the global south. So you tended to have back then a very open, horizontal relationship. And this, I think, also allows for some flexibility when it comes to addressing emerging issues like humanitarian crisis or the global pandemic as well, because those relationships, once you build a relationship of trust, then I guess it's more easy to adapt and be flexible in the face of changing times. I don't know if I have replied to your questions. I just added a bunch of other thoughts. Thank you, Lilian. Thank you,
Fiorenzo. Shall we first, Ibrahim, I can see you. Shall we first let Tosin answer Lilian's question, and then there are also some questions from Susanna and Denny.
Okay, hi Lilian, thank you for your question. And yes, very inspiring work, sometimes very depressing. And we really agree that this is the role of government, and in saner climes, this wouldn't be the areas that we're playing. Yes, government wouldn't be able to do everything, but at least we will be able to supplement, and it wouldn't be. But the roles kind of is shifting and is disappointing. And ideally in slum communities with situations of poor shelter and just poor living conditions like this, what you would expect is a slum upgrade, resettlement, legitimizing the slum, because a lot of crime also happens in slum because it's an hideout, and just addressing the real issues, because the slum already is where is densely populated. A lot of people live there. So, and there is also a shortage of housing. So as opposed to moving them and promising to resettle them, just upgrade the slum, or, but I will say that government has a will, but they have a selfish will. And what has happened in the past is that there's been a promise to resettle. Some other people will live in other slums, and that promise never came true. So if there's anything, many of the slum dwellers are a bit careful for us to engage the government in a way that can make them poorer, because they may then ask them to leave the slum and never fulfill their promise to resettle them. Government would typically only come into the slum at about the time for election, because they know that they have huge numbers there. So for selfish purposes, they'll come into the slum and mobilize a lot of youths to vote for them. And because poverty is really bad, people forget that, saying no to things like that and saying people should keep their promises is more important than collecting whatever it is that they are trying to give you to buy your votes. So that's a real issue there. So what we do and what individuals and corporate organizations and private organizations are able to do for us and with us is we recognize that this is like a war against government. And if you wait around for them, you probably never get anything done. So at however small scale, we continue to provide seed capital, for example, which is one of the things that we do for women mainly. And our belief is that when people begin to earn their own personal income, they can make such decisions as relocating themselves out of the slum if you really want to get out of it. We will work with you to ensure that you're saving, you are investing, and we're supporting your business or whatever it is that you do. But the decision to leave the slum would rest upon you if we cannot, because we cannot provide shelter for everyone. And then we take education seriously because education does provide exposure. Many people, as they begin to go to school, go to the university, of course, income will come, they'll get a job, but then they know that I shouldn't live here. This is not where, and then they relocate their families and all of that. So our support and our interventions, however, at micro level, are the only things that we can do, even though we continue to engage, the government and through advocacy, we speak up on these issues on our pages and call them out carefully, in a way that, would not affect the slum dwellers badly. We just continue to do whatever we can with support from private. Even the school that we've recently adopted in the slum, for example, we're leveraging support from a private institution to just adopt that school, provide infrastructure, because we realize that if we wait for government, their living conditions will worsen, people will be out of school, abuse, criminal activities, so many other things will continue to go bad while we wait for them. But I totally hear you. Thank you, Lillian.
Ibrahim, do you have any question? And then I can read Susanna's question. You are on mute.
No, just trying to respond to Susanna's questions. So that's it.
That's great. Please go ahead, and then I can read the question for Fiorenzo and Tosin. So Susanna has asked Ibrahim, what has civil society in Libya, Lebanon, and Palestine learned about how solidarity works in the context of COVID-19? So this is the question that Susanna asked.
Yes, yeah. Thanks, Susanna. It's that you. Exactly, you mentioned solidarity, and the context or the social background of these countries, the solidarity is very high in terms of supporting each other, particularly at the grassroots level, particularly in specific in the area which most marginalized or actually suffering from violence. Or I'm not talking about the cities here, I'm talking about, the areas that, it's out of the main cities. So for example, it's according to my information and knowledge that many of business people, they actually supported some initiatives through small local organization in order to help the people. So the concept of solidarity it's different, not like it's the concept that we have it here in the West, but they live it every day, they help each other, even though personally, even the level of solidarity, not like 20 years ago or more. So the concepts now change. However, I think that we need to tackle it and to research it more in terms of development and the civil society, particularly at the grassroots level. And really thank you that you brought it back to the discussion, but the solidarity concept is very important for the people. When I have a conversation with different, it's different, 3 different cultures. Let's say cultures, Lebanese, Libyan, and the Palestinians. Their concept is different, even though they speak the same language, they have the same issues, common problems, but the concept itself is different. It's even who live here in the West and they travel frequently, for example, to Libya, even their way is different, but the concept itself is still there. The people, they actually rely on each other, they support each other. And even, by the way, even more, some of the grassroots organizations, they don't receive any penny, any cent from the international aid. And they rely in the local resources. See how it works. They live in poverty, they are suffering, but they function, they rely in, they pay their time, they give their time, and the resources from local businesses, even though it's very small, but it means a lot for them. This is, actually amazing. But, still, as a researcher or a practitioner, we need to tackle it and to look at the different aspects, how the term of solidarity actually is different from 20 years or 10 years or more. But we need, I believe that is good if we can, tackle it from different perspectives.
Thank you, Ibrahim. It looks like it would be a fantastic research project to explore really and unfold how solidarity is understood in that context and the differences across those nations. So it would be absolutely a fascinating research project. Yeah. And thank you, Susanna, for your question. There are 2 other questions, one for Fiorenzo, one for Tosina again. To Fiorenzo, can you tell us more about how you assess the data that you presented for your research? And to Tosina, Susanna would like to know whether there are more maternal health interventions beyond the distribution of sanitary pads. What else are your organization doing? Thank you. Fiorenzo, do you want to start?
Yeah. So very simply, the data I accessed were open data made available through these transparency and accountability project that has been launched in Italy 5 years ago, maybe. I'll copy paste the link here. The website is only in Italian, of course, because that's very Italian to do. But it is a great project, actually, because finally it is starting to map out a sector that has been under the radar for a while, because it is so hard to find accessible data regarding Italian NGOs. So I tried also to get in touch with the agency under the Ministry of Foreign Affairs, which is responsible for NGOs, but they really have minimal information in terms of data. They do not even have a register that they update. So I wanted just to understand how NGOs evolved over time in terms of enrollment to national register, and even that was not mapped out. So you can imagine that there is so little information. And so all NGOs just share voluntarily their data. They do an annual questionnaire usually to gather information about human resources, their budgets, their areas of intervention. And since they have built up, so this project had built up already a relationship with NGOs, but it was easier for them to access COVID-19 specific information. So in the first case, they launched a brand new questionnaire. So for the first set of data I was referring to, it was a brand new questionnaire. And in the second one, I think they did something similar to what Ana Luisa did. So they incorporated in their questionnaire specific questions about COVID-19. So you can surf the website if there is any information relevant for you. And if you need any help to go through the Italian, you can reach out to me.
Thank you, Fiorenzo. And now we go back to Tosin, and then I have a question for Ana Luisa. But Susanna, sorry, were you referring to maternal health or menstrual health?
I was sorry, I should have said menstrual health.
Okay, sorry, it was my.
Thank you.
Okay, thank you, Susanna, for your question. So regarding menstrual health in the slum communities, like some of the challenges that I have, alluded to remain a huge challenge in the slum communities. And like we alluded to in our presentation, Rights to water and access to water is a challenging problem for women and girls, especially in slum communities, because women require water, apart from even to cook, but to clean. Even when you're on your period, you should be able to access water easily. But imagine that you have to buy water every time. So you can imagine that, the cleanliness is, but outside the slum, we do a lot of other things in the area of menstrual health, even in the schools where we provide menstrual health support and sexual and reproductive health training. We're able to also help to better the conditions of the washrooms, and also educate the boys to reduce the stigma, especially for women. Menstruation is okay, but in the slum communities, there's only so much we can do. But the focus for us as an organization working in slum communities and providing menstrual health support is to at least provide sanitary products for girls who live in the slum, because we have, from evidence, we've seen cases where people have to transactional sex, really, sex for pad, and that's the burden on our own heart in respect to this intervention. So it's to say, how can we support girls that live in slum, even though we're dealing with issues of access to water. Of course, safe washroom is not the way that can't even apply, because even the shelter is poor. So you can imagine, like the toilet I showed, in case we may have missed seeing that when I lost the slides, but like the condition of the washroom is terrible in the slum. So, but at the level that we can support, we continue to provide, the menstrual sanitary products and then sexual and reproductive health training, and also just addressing issues, because many girls that live in the slum, and there are a lot of people that live in houses because, so the mother has a child that is 16, but the child that is 16 is also has been pregnant, has also given birth to another child that has given birth, and some of these things are because of poverty. So period poverty is something that we're trying to address. So in respect to the slum, that's the solution that we provide. Outside the slum, we're able to provide better support and address issues of water, safe washrooms or clean washrooms, and all of that, sexual and reproductive health. But in the slum, we really just provide sanitary products to curb transactional sex, and period poverty in the slum.
Thank you very much, Tozin. And I wanted to ask one of the final questions to Ana Luisa, because during your presentation, you mentioned about adaptation and innovation, and you were talking about how these two concepts often do overlap. And I was wondering whether you could expand a little bit more of this and maybe linking this with some of the examples that you mentioned, so that we can understand better about these two concepts in practice and in theory. Thank you, Ana Luisa.
Yeah, you're welcome. Right, so it's not a very easy question, because when we are speaking about innovation in our context, we're actually speaking about social innovation, and that always has a component of, or always allows for thinking about adaptation as a form of innovation. And that means bringing something from somewhere else to a different context and say, okay, well, that's an innovation in a new context, right? But what I was referring to was actually the fact that some organizations, you can see that either they adapt to what is happening on the ground. For example, the Colombian example was quite good, because what the interviewee was telling me was, okay, look, we had a few different types of situations. Either we had organizations that were working mostly on an existentialist model, and they couldn't continue because of lack of funding and so on. So basically their work just stopped. Their value added just didn't exist anymore, and they just weren't self-sustained. Other organizations, for example, they still had funding, they still had activities to go on, but they were all in-person activities, and they were able to adapt through digitalization and so on, and keep going in their activities. Once other organizations that are working, for example, in areas where internet connection or cell phones don't really work, they had to actually think outside the box and say, actually, we still need to reach the people, and we need to perhaps do something else. So we had reports, for example, of them starting community networks, a bit like what we were seeing this morning in the Nigerian example. So that's the kind of examples that I'm looking at. Yeah.
Thank you very much, Ana Luisa. Thank you. Is there any final questions? I would just like to share with you a reflection, because there are some issues that have emerged several times during the two sessions with regard to an increase in private funding for NGOs that has emerged in different presentations. And then issues regarding digitalization, localization, and restrictions or enlargement of civic space, but especially with the three first points that look like they are really common outcomes of the pandemic: private funding, increase in private funding, digitalization and localization. I think that's an important reflection that we didn't have the time to explore today, but maybe we could do in a meeting in the following months, is to watch how they are impacting issues of equality and justice and social justice. Because there were some comments this morning that I would have loved to explore further. To what extent is private funding, for instance, how it is impacting on social justice, how it is making NGOs and civil society organizations more able to work toward the missions, or to what extent is becoming another trap, another constraint similar to those that we all know very well. And the same with digitalization, because we discuss how that has opened new spaces, but has also even worsened existing inequalities of the most vulnerable. They don't have any access to internet connection or electronic devices. So I think that there is a discussion that I would really love to continue with regard to how these new directions are impacting on social justice and equality in the global south and in the global north, because as we saw, there were also in Italy and in other northern countries, there are interesting asymmetries and dynamics that, yes, would be interesting. Maybe this could be a theme for a meeting of our study group. What do you think, Ibrahim?
That's really fantastic that you reflected and trying to actually summarize what has been discussed this morning and just in this session. Actually, of course, I agree with you, Emanuela, that these are common issues. Even all of we have mentioned, actually, even before the pandemic, and the pandemic increased all of these issues, and actually badly to some extent. Always we need to tackle these issues in terms of social justice, equality and inequality, all of these things. So take it from here, if we can summarize, or let's say kind of build a seminar or a conversation among ourselves, other participants, students, PhD students, and take it from here for next activity. And even though always, even I have been looking to some kind of sharing ideas, and some of let's say suggestions emerge from some participants. It really attracted me, and it's a group of participants. They actually they want to focus on volunteers and opportunities in the NGOs, and I personally engage with them, love to help in terms, because they're looking for a Zoom link, whatever, and they're based in Africa. Actually, I think in West Africa, they want to do something in the 5th of July, something related, what have just been said in terms of voluntary opportunities, all of these things. It's good even to engage with them, not to listen to their own conversation. And also I just actually written to them that, it's even 2 days from now, the 5th of July. So it's very short time, to kind of circulate information or to post information or even announce about it. So kind of different ideas, but how even I also use this opportunity to ask all colleagues, please come forward. If you have any ideas, we can take it from here. And to add it, what you have just mentioned, Emmanuel, it is great, to continue this conversation and use this, shifts of the even sitting at home or at offices using the Zoom, and to continue the conversation. Not even, I love, to continue the conversation from time to time, not only relying in the annual conference, to be honest with you.
Exactly. And yes, we will be back in touch, but you can also, propose any topic for a meeting. We would absolutely love if there was any issues that you would have liked to explore more during today, but we didn't have the time. Please contact us, suggest a theme for a meeting, as a workshop, and we would love to organize it together with you.
Thank you, Manuela.
Yeah, so it's just very quick, Emanuela, really, it's as I said this morning, that's really, I enjoyed the presentation, and to have to see, like, to engage with new intellectual students, PhD students. Really, I enjoyed all of the papers, and it's good, to have this, capacity, expertise, reflections from the ground. It's all of the papers excellent, and I love to see them that, it's actually to be published as a one volume. And this is actually trying to take, this idea to what we discussed earlier, Emanuela, and if you would like to reflect on this issue as well.
Yes, as we mentioned via emails, we were thinking of developing an edited book from this stream, opening also to other potential contributors. Now that we have listened to all the different presentations and we have a better idea of the potential contributions, I think that Ibrahim and I are in a better position to develop an abstract, an outline, and we will be back to you. And if it's something that could be of interest to you, we would love to work with you for this project. But of course, we need to send you some more detailed information, and we will do it as soon as possible. Now it will be easier because we have a better picture of the different contributions and the different topics that we can enlighten. Any other comment from any of you or Ibrahim?
My last comments to thank all of you, who actually part this morning or afternoon. Really, it's very interesting once again. I love it, and really sharing ideas from all of you. I think, it's fascinating, and please stay in touch and continue the conversation.
Also on my side, thank you very much. I really enjoyed both sessions, really informative, interesting, and so diverse. And I think it has been a fantastic panel. And thank you very much for your participation and your work.